Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what dyslipidemia is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice. All right, let's dive right in. So, here's our roadmap for today. We're going to start with the basics, what dyslipidemia even is. Then we'll look into its causes, what to watch out for in terms of signs, and how we actually diagnose it. After that, we'll cover the management strategies. And finally, we'll wrap it all up with the most important takeaways. Okay, first things first. What exactly are we talking about when we use the term dyslipidemia? And more importantly, why is it such a big deal for our heart and blood vessel health? In simple terms, dyslipidemia means you have an unhealthy level of lipids, fats like cholesterol and triglycerides in your gut. But here's a really critical point. We don't just define it by some random abnormal number. Instead, the definition is actually tied to the level at which we have solid medical evidence showing that treatment, that is, lowering those levels, really helps reduce the risk of cardiovascular disease. When we look at a blood test, there are three main players we're focused on. You've got LDL, or low-density lipoprotein, which you've probably heard called bad cholesterol because it helps build up plaque in your arteries. Then there's HDL, or high-density lipoprotein, the good cholesterol that actually helps clear it away. And third, we have triglycerides, which are another type of fat our body uses. Now, of all these, the strongest evidence we have points to one thing, the huge benefit of lowering high LDL cholesterol levels. And this right here is the central problem. The real danger of dyslipidemia is this process called atherosclerosis. You see, over many years, those extra lipids in the blood get deposited into the walls of our arteries. They form these hard structures we call plaques, which slowly but surely narrow the pipeline, making it harder for blood to get through. This is what sets the stage for really serious events, like heart attacks and strokes. Okay, so we know what dyslipidemia is and why it's a concern. But where does it come from in the first place? What's causing these lipid levels to get out of balance? Well, we can really sort the causes into two big buckets. On one hand, you have primary causes, which are genetic. This means there are mutations in your genes that mess with how your body makes or gets rid of lipids. And on the other hand, you have secondary causes, which are tied to things like our lifestyle, other health problems, or even some medications. You know, for most adults, it's these secondary causes that are really driving the issue. Things like not getting enough physical activity or eating a diet loaded with saturated and trans fats play a huge role. But it's not just that. Other medical conditions are tightly linked, especially diabetes, but also things like chronic kidney disease, an underactive thyroid, and drinking too much alcohol. So what does this look like in a person? How does dyslipidemia actually show up? This next part is absolutely crucial to understand. For the most part, it doesn't. It's what we call a silent condition, meaning it usually has no symptoms at all. However, in some really severe cases, especially the ones that have a strong genetic link, the body can give us some visible clues. And these are really important for clinicians to spot. We're talking about things like fat deposits showing up in tendons or on the eyelids, which can be a dead giveaway for a serious underlying lipid disorder. Take this, for example. These lipid deposits in the tendons are called tendinous xanthomas, and they're a classic sign. They're what we call pathognomonic for a genetic condition called familial hypercholesterolemia, which is a fancy way of saying that when you see this, it points very, very strongly to that specific disease. And in the same way, seeing these yellowish fatty plaques on the eyelids, called xanthelasma, can be another telltale sign that someone's cholesterol levels are extremely high. So if it's so often silent, how on earth do we reliably find it before it starts causing major problems? Well, the good news is, the answer is pretty straightforward. The diagnosis depends entirely on a simple, common blood test. This test is called a serum lipid profile, and it measures all those key players we talked about earlier. It gives us the hard data we need to figure out a person's lipid status and their overall risk for cardiovascular disease. And what's really helpful is that these days, you often don't even need to fast for a screening test, since some of the key numbers don't change much after a meal. That just makes it so much easier for people to get checked. To make sure we catch this early, the evidence-based guidelines give us a clear schedule for screening. The first check should happen in childhood, between ages 9 and 11, and then again in the late teens. Once you're an adult, the general recommendation is to get screened about every 5 years. Okay, so a diagnosis has been made. What's next? The goal is all about lowering the risk of heart disease down the road. So, what are the core strategies for managing dyslipidemia? The approach is really a two-step process.
Step 1, and this is always the foundation, is lifestyle changes. We're talking about diet, exercise, and weight management. Then, if those changes aren't quite enough, or if someone's risk is very high from the get-go, we move to step 2, medications.
And this gives us a great overview of the main tools in the medication toolbox. Statins are really the cornerstone. They work inside the liver to slow down cholesterol production. Ezetimibe works in a totally different place, the intestine, to block cholesterol from being absorbed. Then you have newer drugs like PCSK9 inhibitors that help the body clear out LDL more effectively. And finally, fibrates, which are mainly used to bring down high triglycerides. When it comes to statins, the evidence is incredibly clear. The clinical trials show that 4 major groups of people get the most benefit. This includes anyone who already has cardiovascular disease, people with extremely high LDL levels from the start, and certain adults who either have diabetes or a calculated 10-year risk that's above a certain level. We've covered a lot of ground today, so to finish up, let's just boil it all down to the most important points you should remember. So, to sum it all up, dyslipidemia is a very common, very major risk factor for the hardening of the arteries. It's caused by a mix of our genes and our lifestyle. It's usually silent, which is why we diagnose it with a simple blood test. And because of that, screening should really start early in life. The good news is that it's highly manageable, with a strategy that always starts with lifestyle, backed up by medication when needed. And that really leaves us with one final practical question to think about. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.